And we talked about these two parallel processes: advances in MRI sequences, MR thermometry, we'll talk about it, and development of MRI guidance platforms, ClearPoint really being the lead in that. And also pharmacological, we talked about that. Gene therapies, vectors, chemotherapeutics that are really just at the beginning of their development at this point, and very exciting stuff that is in the pipeline. So let's go through these. Some of the technology that was developed. So LIT, this may be something that many people are familiar with right now. Laser interstitial thermal therapy, where here's a picture of it, where we are able to place a laser probe into a lesion and start to burn the lesion. And it really has changed how we treat many disorders. I mean, it's still, I would consider, it is fairly advanced in terms of adoption across the US and probably internationally as well, but it's still in its infancy. We still are or maybe in the toddler period, we still have not fully utilized the capabilities of LIT. But just by now, this is a nice review, and you could see the expanse of the utilization of LIT for tumors, gliomas, multiple articles there, brain mets, radiation necrosis, we're using it for, meningiomas we're using it for, and also epilepsy, amygdala campectomies, really almost replacing temporal lobectomies, corpus callosotomies, lesionectomies. There have been some case reports of corpus callosotomies for pain disorders. So it really is expanding in a really rapid sense. So now let's talk about stereotactic surgeries. Really, ClearPoint has been a leader in this realm, and this has brought stereotaxy into MR space. Our ability to do stereotactic procedures has been greatly enhanced by real-time imaging and ability to do imaging, guidance, confirmation, intraoperatively as we're doing these procedures. It really has been an incredible tool in treating neurosurgical disease. There's many applications for this at the, certainly for DBS. It's become an accepted standard for DBS placement, for biopsy and ablations for laser has become really used. As well as we talked about laser and biopsy as well. So multiple articles are coming out demonstrating the utility of this, and also other articles are coming out demonstrating the improvement in safety of trying to do these procedures in one place. LIT procedures, traditionally we put the laser probe in the OR stereotactically and then ship the patient down to MRI and then do the ablation part in MRI. And if you think about the flow of that, the potential of safety issues for the patient, the cost of running the OR, really being able to marry all of that and do it in one space in MRI really changes things. So that's certainly been an incredible addition to our tools. And we'll go through for those that are on the webinar and are not very familiar with it. So I'll go through some of the pictures of one of these cases. This is a patient in an MRI, obviously, here their head is in the imaging coil. Now, this is an older coil. We use more flexible coils now, but the patient's head is pinned through the coil for this procedure. Here we're starting to prep the patient, and we then put a drape on. It's a very unique drape where it places the patient's head in a sterile space, and the patient can go in and out of MRI for imaging, and still this area remains sterile. So it's a pretty ingenious drape. And here we are. This is a patient. We have put our fiducial markers on the patient's head, and they're going in the MRI to get imaged. And here we are planning our procedure. This happens to be a DBS, so we're planning our, we pick our ACPC, our internal landmarks, our trajectory, and so forth. And once we confirm our trajectory and identified on that grid, we start the procedure, making our incisions, placing, these are the ClearPoint bases that are affixed to the skull. There are more iterations of this where there are scalp mounted ones that we don't need to make such large incisions for. So there's a lot has changed for that, but this is the basics of the process. And here we are attaching the smart frame, and this is essentially a mini stereotactic frame that is attached to the patient's head, and we're ready for the process. And as we go through that, here we are identifying our trajectory. We've made the burr hole there, and already we've made the burr hole. We are aligning that smart frame that you saw to ensure that we're at our target. And here we are at the target, and we confirm with imaging to ensure that we are accurate, and the accuracy has been reported in multiple papers to be on average about 0.6 millimeters, which is excellent. So here we have it. This is how we place electrodes using ClearPoint. The same thing can be done for biopsies, and the same thing can be done for laser. And the advantage of using ClearPoint for laser is we're not tied to a particular trajectory. In the OR, when we place the probe, that's it, that one probe, or we have to put multiple probes for different trajectories. Here we can, as long as we plan the trajectory through the same burr hole, we can do multiple trajectories. And this is also cost savings for the hospital because these laser fibers are not cheap. And again, here we're confirming our placement, and we're again happy with that. I wanted to show a couple of videos. When I was training, there was a lot of discussion. Is BrainShift real? Does BrainShift really affect the deeper targets? I think that's been fairly settled, but I think seeing pictures of it or video of it is really remarkable. So this is clearly there's cortical shift during the process. As we open the burr hole, there's air entry, and that's shifting. Well, that's not as disconcerting as this. So this is basically, you see actually the ACPC shifting. So the deep structures are shifting. And imagine doing doing this process in the OR without updated imaging, and we're trying to find the STN or the globus pallidus, and with physiology, and we have to do multiple passes through the brain. So it really does add to the safety of our patients when we're able to do a single trajectory and deliver our electrode. So going on to now, marrying the guidance technology with the advances in therapeutics. Now, this is an experimental study, and it's not FDA approved, but it really does show the ability. So here's putaminal injections of a vector that delivers a gene, and we precisely can identify our trajectories, precisely identify our targets, ensure delivery of the material. And this really is in its infancy in terms of how we will address neurological disease in the future, whether it's oncological disease or progressive diseases like Parkinson's, or diseases which we currently don't have any therapeutics for, like ALS. Look for more of this to come. There is huge applications to the NIH for grants for a variety of therapeutics, gene therapeutics and vectors. So this is going to expand greatly, and ClearPoint really is at the forefront of allowing utilization of this advance. And so, and the last thing in terms of options options in the OR that we have is this MRI guided focused ultrasound, which is an incredible tool. This is what the device looks like. There's a transducer with about 1,000 elements that emit ultrasonic ultrasound waves. And very similar to radiosurgery, where we focus this on a particular spot, we can do the same with MRI-guided focused ultrasound and create a lesion, and the results are really incredible. This is a patient with essential tremor, and we do these awake. The patients are awake. I'm sorry, my light just went out as you're watching the video. And here we're looking at it right after the procedure. I mean, an incredible instant change in the patient's life. And it really is gratifying for both patients and doctors as well.